Hello, my name is Rochelle Brannon. I'm a physical therapist and a certified lymphedema therapist. Please note the following presentation is for educational purposes only and is not intended as specific medical advice. Summer brings fun and the sun for most people, while bringing worrisome challenges for those diagnosed with upper and lower lymphedema conditions. If you're newly diagnosed with lymphedema or need a refresher on how to manage your lymphedema this summer, then please pay attention. Remember, you can still have fun and stay healthy this summer. So lymphedema and that summer sun, do please apply lots of sunscreen before heading outdoors, even for gardening. Those UVA rays are closer to us. We're getting less atmospheric protection, and there's a greater risk of getting sunburns faster. And if you do get a sunburn, know that sunburns raise your body temperature and cause an inflammatory response, both of which causes additional swelling. Do wear clothing with moisture wicking properties and UVA protection. Those types of properties on the clothing will help keep you cooler and help offer some protection from the sun. Don't be outside during the hottest part of the days, which is 11 a.m. to 3 p.m. You really want to try to limit yourself to those hours so that you avoid overheating. If you're going to be outside in the summer hot sun, do plan your walks and your outdoor activities in the early morning or early evenings. And if you are going to be out there, even when it's hot or cooler, bring a small spray bottle of water and keep yourself cooler. Avoid overheating. If the heat is more than you can comfortably tolerate for an hour or so, that's a sign it's time to cool off somewhere else. Find some shade or use your hand fans and spray bottles to cool off. Do choose clothing that is lighter in color. The darker clothing colors absorb sunlight and attribute to increased heat, which can lead to increased swelling. And it goes without saying again, do stay indoors during the hottest part of the day. Sun and hydration. A simple piece of advice, but it really can't be overstated how important it is to make sure you're giving your body the hydration it needs as the summer temperatures climb. Staying well hydrated makes it easier for your body to regulate its temperature. Don't wait until thirst is the indicator causing you to have something to drink. Waiting until you're thirsty is a sign you're 20% dehydrated already. Do minimize diuretics like alcohol, tea, and coffee, which are considered diuretics and can cause dehydration, especially in the heat. It's recommended to drink 1 full glass of water, which is 8 ounces, for each diuretic consumed. Don't binge on salty foods in the sun like potato chips, chips, and salsa. Salt causes the body to retain fluid. Dehydration causes the body to retain fluid, which is now a double whammy insult to your lymphatic system and worse for the person with lymphedema impairment. That pepperoni pizza and that cold beer may not be worth the consequences of increased lymphedema heaviness. Swimming and sunburns. Yes, it's true. Aqua exercising in cold water during the summer is a great low impact workout to help lymphatic fluid. Water also provides a natural compressive force on your body and affected limbs. Don't forget that your sunscreen should be waterproof as well. And also know that you need to apply a moisturizer barrier cream before and after getting in the water. Chlorine pools can have a drying effect on the skin and cause skin breakdown. Do wear protective clothing, especially in the oceans and lakes if you have lower extremity lymphedema, to prevent skin, feet cuts, and risk of infections. Goes without saying, but please don't be swimming with open sores, which will increase your lymphedema risk and infection. And fungal infections are far more common in the summer as more time is spent in the water and with bare feet. Fungal infections are complications that are uncomfortable for people living with lymphedema. Try adding some powder into your shoes with an unscented bath powder or an antifungal powder to help keep infections far away. This is especially true if you find yourself going to a lot of public pools and public showers. Please wear shoes to help you decrease your risk of infection. Summer compression. You might not be aware of it, but your compression garment can still get sun passing through the garment onto your skin. So do apply sunscreen to your arm, your hands, or your fingers, or your legs before you go outside. Don't be afraid to wear your compression garments when it's hot. It is uncomfortable and it is awkward, but you really don't want your edema to get worse. You do need to wash your garment more regularly during the summertime to avoid deterioration from sweat, body oils, and sunscreen. Don't overheat. And if you are finding yourself overheating, go elevate that limb, remove your compression garment, and place a cold, wet towel over the affected limb. Elevation helps return the fluids back to your heart, and the cold towel brings down the body temperature. Do chill your daytime compression garment by putting them in a plastic bag or a Ziploc bag so they don't get damp. And this doesn't permanently keep the garments cool, but it does provide a nice cooling sensation to the limb for a while as you're putting them on. And don't forget about your nighttime garments too. You can put those in the refrigerator prior to wearing. At least a little bit, it will stay cool. You can rest your quilted limb on an ice pack. Don't place an ice pack directly on your skin. Use ice at night by placing it inside your pillowcase. Rest your limb on the pack to reduce swelling and discomfort. Summer insects, those mosquitoes, nicks, cuts, and scrapes, all concerns if you have a lymphedema impairment. Do apply insect repellent before going outside. Prevent those bites and infections. There's lots of natural repellents to choose from. Don't scratch your bites. Breaking the skin could lead to increased swelling or worsen infection. Do treat those insect bites or scrapes or nicks as soon as possible. You want to wash and dry the area completely before applying an antibiotic cream or ointment. And don't forget to carry a small bug spray bottle with you as you're going hiking. Mosquitoes love wooded areas, standing water, so try to avoid those spots during the dusk hour. If you enjoy camping, fishing, sometimes nicks and cuts and scrapes just happen with those activities. Plan to bring along a specialized first aid kit that includes alcohol wipes to clean any skin breaks, antibiotic cream, and bandages. Do seek medical attention if you notice warmth, redness, pain, or increased swelling in or around the site of the wound or the mosquito bite. All those things will help you minimize infection. Summer car travel. We all want to get there as fast as we can without taking breaks. But try not to stay in one spot for too long as you travel in the car, as you know that you'll have an increased risk of swelling. It's recommended to try to stop at rest breaks about every 1 to 2 hours. Get out, stretch your body, and walk around. It will definitely decrease the risk of swelling. Don't forget the ice cooler. It's great for hydration. And you can take a compression sleeve, put it in a Ziploc bag, and put it in the cooler. And when you're at that rest break, you can trade them. You can put on the cooler one and put the one you've been wearing back into the cooler. Cooling techniques can maintain lymphatic flow and minimize discomfort. Air travel can be difficult for those living with lymphedema. Pressure gradients differences between the body and the cabin pressure result generally with peripheral swelling. With air travel, if you can, please do request an aisle seat so you get more freedom to move around. Don't remove those shoes. If your leg swells during travel, it's going to be much harder to put your shoes on afterwards. Here's a great tip. Wear adjustable shoes so that if your feet swell, you can adjust your shoes to fit your feet. Do wear your compression sleeve. Wear it 2 hours upon landing, which allows your lymphatic system to adjust to its new environment. Don't forget to wear your hand gauntlet or glove. Fluid nearly always takes the path of least resistance, which means that any fluid in the arm will go to the hand if it's unprotected. So please wear a hand gauntlet or a glove to keep your hand from swelling. Do perform in-flight muscle lymphatic pump exercising. You know these very well. You know if you have arm swelling, you can do ball squeezes, shoulder rolls, roll your wrists, wiggle your fingers, bicep curls, standing, waiting for the bathroom, stretch your hands above your head, go side to side, heel lifts, mini squats, leg lymphedema patients, you know ankle pumps, alphabet writing with your feet, little marches in place, hip lifts. Any movement will stimulate your muscles and improve lymphatic lymph flow. And above all things, you're well trained in doing diaphragmatic breathing. That is going to be the number one always go to if you have lymphedema. So increase your diaphragmatic breathing as you travel. Air travel. Don't forget hydration. Fill that water bottle before you get on that plane, as they're just not coming around with enough water these days. And if there's any turbulence, you don't get any water. So don't forget to fill that water bottle. Do you have a small pillow? Airlines no longer automatically have small pillows that they give to us. Place your affected arm on that pillow for comfort, elevation, and easier arm exercise room. And don't wear tight clothing which constricts the affected limbs. Wear loose, breathable materials. Good choices are 100% cotton, linen, and other fabrics, allowing air to circulate through your clothing. Do allow more time for airport security. Sometimes security personnel are mistrustful of compression sleeves, gloves, and pneumatic compression devices. Don't forget to create your list of your emergency contact, the medications, and doctor's information so that you're prepared for any emergency. Another golden tip is don't put your compression garments in checked luggage. Keep them close to you in your purse or your carry-on so that if you need additional compression to reduce your arm, it's there. Or if you needed a replacement due to getting an unfortunate tear or dropping something on your compression garments and it's now sticky, you at least can trade them out. Also, this includes anything important for managing your lymphedema, such as moisturizer, small first aid kit for accidental cuts. You want to keep all that close to you at all times. Have a good time, and thank you so much, and enjoy the summer.